Good morning and welcome. My name is Megan McCormick. I'm a clinical psychologist from Georgetown and a part of the School Echo Hub team. Today, I will be talking with you about school staff well-being, which is a big part of the work we do through the Georgetown Center for Wellbeing in School Environments where I work. I hope that today you'll be able to leave here with an understanding of the consequences of educator stress, to be able to describe the three types of interventions that make up a comprehensive educator well-being approach, and to be able to name an intervention for enhancing educator well-being. It's no secret that educators are stressed. In fact, K to 12 teachers are the most burnt out profession in the United States. And we know that this differentially impacts Black and Brown educators. And the sources of stress are far-reaching. They range anywhere from systemic issues to school cultural issues and even relational issues. And we're still feeling the impact of the pandemic, which mostly comes in the form of staff vacancies that are increasing workload on existing staff. The consequences of educator stress are wide-ranging. Not only are educators at a higher risk of mental health conditions, but a large majority have experienced stress-related physical health issues. As a result, we have a tremendous problem with attrition. Nearly a third of educators leave the profession within their first 5 years, especially in urban areas. And this is costing our country billions of dollars each year. Not only are educators themselves affected and schools affected with regards to turnover, but educator stress and turnover has a destabilizing effect on students, schools, and communities. There is a growing body of research to suggest that teacher well-being is associated with the way teachers teach, the way they build relationships with students, and as a result, student outcomes such as social emotional functioning and academic achievement. While many schools and districts have gained awareness of these issues and are increasing their attention to try to prevent turnover, approaches are often centered solely on individual change. And we know that over-focusing on individual interventions or even outsourcing educator well-being can actually work to increase feelings of burden and erode trust between staff and leadership. So a multidimensional approach that involves systemic change is critical for making meaningful impact. This is a framework being discussed in some research and actually being implemented in our district here in DC. It differentiates three different types of approaches that collectively make up a comprehensive system of supports for educator well-being. The first is individual interventions, which really focus on helping individuals manage the stress that is within their control. Interpersonal interventions that focus on building workplace and classroom relationships, and organizational interventions that focus on changing the school's culture to prevent stress from occurring in the first place. So let's discuss what some of these interventions might look like. We've been able to do this work as part of our center and often find that organizational interventions tend to be some of the most challenging to get buy-in for and to implement, but are also some of the most impactful for educators and sustainable over time. Improving workload and managing job demands at first glance can be something that school leaders say, there's nothing I can do. But there are ways that schools can get creative with this, and we've been able to work with a number of schools in looking in detail in collaboration with their staff at the way that they can just make jobs feel more manageable. So one example is assessing the master schedule in consultation with staff to reduce inefficiencies and prioritize personal care. We have a school that was able to really trim the fat on the number of meetings that educators were required to attend, implemented agendas so that these meetings could be more efficient, take up less time, and reduce duplicity between email updates and in-person updates. And this made a huge difference for staff. Another critical aspect of this is outlining an effective onboarding process with staff input that sufficiently and comprehensively trains staff for their roles. This is critical, especially given the issues with turnover and the number of new staff that are entering buildings every year. Compensating staff for additional voluntary work that contributes to schools' missions is one way that we can overcome some of the problems that are faced in with regards to salary for educators. There's often not much that schools can do in raising salaries, but they do typically have budgets where they can provide some of this compensation for staff that are going above and beyond. And finally, hiring additional support staff, even part-time, instead of relying on existing staff to cover responsibilities that are outside of their job descriptions, which we just hear over and over again is a huge source of stress for people. Another way that organizations can intervene at a high level is to integrate well-being into school culture, and doing this from the top. One way is through leadership promoting anti-stigma messaging. We work with one really special school where all of the school leaders agreed to enter into individual therapy with our team, and to be really transparent with their staff about that, so that they weren't just saying, hey, take advantage of mental health services, but were really modeling that and demystifying the process of therapy for their staff. Many schools have done this thing where they're finding space and creating a staff wellness room that really looks a lot different from the teacher's lounge, where people are microwaving and eating and talking. These staff wellness rooms are places that are really centered on quiet and de-escalation and de-stimulation, and almost look like a spa when you walk into it, which has been really impactful for many of our schools, and more largely is being seen in some of the research. School-wide mindful moments are another way that schools can organizationally be promoting well-being. This may meaning taking time over the intercom for everyone in the school to stop and take a breath. One wonderful resource that our friends at University of Maryland have put out that I encourage you to look at is the Organization Wellbeing Inventory for Schools. This is housed within their SHAPE system, which is a free and available resource to anyone. If you're looking to do this kind of organizational level work, this allows you to self-assess in 8 different domains and gives suggestions as ways that you can be intervening organizationally to create more well-being. Another aspect, as we mentioned, of well-being intervention is interventions that focus on interpersonal interactions and improving relationships. The most effective way to do this really is to leverage pre-existing opportunities to infuse more relational practice. A lot of schools will jump straight to let's schedule a happy hour for our staff, but again, that puts more burden on staff to do something in addition to where they already are. So what this can look like is dedicating staff meaning time to relationship building. We have a school that we worked with a few years ago who fully redesigned their morning huddle, which previously sounded truly like a pep rally, and actually now includes paired connection time where staff can authentically and vulnerably check in with each other and provide support to one another, which not only helps individual well-being, but also helps create meaningful relationships. Mentorship programs are another way that we can do this within schools, and even using restorative justice practices to resolve conflict between staff members and to proactively create a healthy culture, even to prevent unnecessary disciplinary action. Enhancing relationships between staff and leaders is also a critical step, as we see this as one of the primary stressors that educators report, and one of the primary reasons that people leave their schools. This can look like anything from one-on-one check-ins between leadership and staff, to building capacity in supervisors to listen and validate effectively, to creating proactive feedback loops through things like surveys or committees. And enhancing relationships between staff and students is something that is also critical to the well-being of educators. It's something that most schools and school leaders will promote, but can often feel like something that teachers need to be doing on top of the other demands that they have for managing their classrooms. And as a result, we encourage schools to actually provide time and resources for staff to connect with students, so as to truly make this a priority and ensure that it can happen. Also, developing clear strategies and procedures for responding to behavioral challenges needs to be a part of every staff's um, uh, toolbox and something that will reduce their stress throughout the day. Finally, with regards to individual interventions, I'll just reiterate here that these interventions need to be feasible and not create more burden. So, adult SEL is one approach to this, and some of the most impactful SEL approaches have included things like self-care, specifically going above and beyond the idea of, hey, let's all exercise more and eat healthy, but focusing on sleep hygiene, media consumption, boundary setting. These seem to be really impactful things for educators. Cognitive behavioral interventions can help people become more informed consumers of their minds and identify thinking traps and even utilize strategies like worry time or behavioral activation. Mindfulness approaches have been tested extensively within teaching populations and show really good support. Things like breathing, cultivating self-compassion, situational awareness, and acceptance. And finally, positive psychology or other approaches that enhance meaning and purpose are very impactful, because meaning and purpose is often the protective factor that we see standing out in a lot of the research. What's keeping educators kind of buffered against some of the stress around them. So having educators lean into that by doing things like reflecting on meaningful events or journaling, identifying values, can help to do this more intentionally and bring meaning and purpose to the forefront, which again can serve as a protective strategy. It's also worth mentioning that educators have more barriers to accessing mental health care, given their schedules and other factors that are at play. So thinking about making mental health treatment accessible, even integrated into schools, is a really important thing to consider. And this can be done through community partnerships or, again, leveraging internal resources. That said, I also know that school mental health professionals who are already embedded in schools are incredibly busy people who often don't have time to even meet the demands on them for supporting their caseload of students. So the idea of supporting educators can feel overwhelming. Because of that, I want to mention briefly this intervention that was developed by our friends at the Lab for Scalable Mental Health at Northwestern University. It's called single session consultation. And this is something that we have used on our team, and also train mental health professionals and laypersons up in our community to use within schools. It's an efficient practice that's rooted in solutions-focused brief psychotherapy and can be used to support individual needs through one session. So it's something that allows an educator or even a student to present their challenges and talk through in a really structured way some supports that might help, and to problem solve collaboratively with another person to feel supported. And SSD has really good evidence for decreasing distress and increasing hope in a really sustainable way just through this one meeting. You'll see more resources about this on our resource page if you're interested in getting trained, free and available to anyone who wants it. Finally, I want to just mention a few nuggets about school staff well-being that are related to military-connected schools. So educating staff at military-connected schools about how to best support military-connected students and families can increase feelings of efficacy and success, which are critical to well-being, as we've seen. It's also important to tap into educators' interest in supporting military-connected students, which can be a way to increase meaning and purpose, especially for those with personal military connections. And finally, any well-being supports that are being implemented at military-connected schools should be tailored to meet the needs of educators with personal military connections. And so this is all important to consider for your schools. So some final pearls to walk away with. Educator stress, burnout, and turnover are at an unprecedented level. And this not only affects the well-being of educators themselves, but also the well-being of students, families, and communities. But addressing educator well-being is not a one-size-fits-all approach. It requires a multidimensional framework that looks at organizational, interpersonal, and individual interventions. And these interventions should not create more burden, but leverage internal resources and practices, as well as community partnerships to uplift the mental health needs of educators. What you'll see in these final slides are references and more details about a number of different interventions and resources that you can check out if you're interested in bringing more well-being practices to your school. Teacher-wise, it was actually developed by one of our hub team members and something that we all use and promote pretty widely. The Compassion Resilience website is a really wonderful program. The CDC staff well-being supports also provide a lot for supporting staff well-being, and Panorama has an adult SEL toolkit that is also worth checking out. You'll find, again, additional resources here related to what we talked about today, and you can find our references here. So I appreciate your time and your attention. Please let us know if you have any more questions. We hope that this information can be used to better inform staff well-being at your schools. Thanks so much.